Wrist extension, radial deviation, and forearm supination can be useful movements to strengthen when dealing with pain at the outer elbow and forearm muscles and tendons, also known as lateral epicondyle pain or tennis elbow. To perform weighted wrist extension, place the forearm flat on a bench or table, palm side down, and allow the hand to hang off the edge. Grasp a dumbbell, lift it upward by bending at the wrist, then lower in a slow and controlled manner. To perform weighted forearm supination, begin in the same position, then slowly flip the palm towards the ceiling and return. To make this motion more challenging, grasp the dumbbell from one end instead of in the middle. To perform weighted radial deviation, begin with the pinky side of the forearm on the bench with the thumb pointing toward the ceiling. Lift the thumb side of the dumbbell towards the ceiling by bending at the wrist, then lower. If these movements are painful, it can also be helpful to start with isometric contractions. An isometric contraction means that the muscle is contracting and working without actually moving the joint through any range of motion. In this case, we'll use a heavy dumbbell to limit the amount of motion that can occur. I recommend wrapping a towel around the center of the dumbbell for comfort. To perform isometric wrist extension, place the forearm and palm of the hand flat on the bench with the back of the hand against the dumbbell. Attempt to bend your wrist and press the back of your hand into the dumbbell while still keeping the forearm flat. To perform isometric wrist supination, start with the forearm and palm in the same position, then attempt to flip the palm towards the ceiling, pressing the back of your hand into the dumbbell with a rotational force this time. Isometrics can be modified by adjusting the amount of force you apply. For instance, you may be able to press with maximum effort if there is no pain. In the presence of pain, you may choose to reduce the amount of force to 75%, 50%, or 25% effort.